The Kenyatta National Hospital management has disputed claims that cancer patients were turned away after the breakdown of the only radiotherapy machine in the facility. KNH CEO Lily Cross maintains that all cases of cancer patients who had been scheduled for treatment have been transferred to other hospitals. Fatma Pole reports.
The news of the breakdown of the only radiotherapy machine at Kenyatta National Hospital sent cancer patients across Kenya into panic mode.
Sina nguvu, yani sina nguvu kabisa. Sina raha. Appetite ya kula sina.
Today being the 4th day since the machine broke down, the management of Kenyatta Hospital maintains that no patient was turned away from the hospital when the machine broke down.
Let us not focus.
That all cases of patients that were scheduled for treatment have been handled.
Wagonjwa wote ambao walikuwa wanahitaji matibabu ya dharura na wale ambao walikuwa wanaendelea na matibabu wameweza kupewa hiyo matibabu kwa mahospitali mengine. Na kwa hivyo naweza sema kama mnaweza pata mmoja ama wawili, pengine wao wenyewe ndio watawaambia kwamba wamepelekwa. Kwa kusema kweli hakuna mgonjwa ambaye alirudishwa kwamba mashine haifanyi kazi.
Sijapata huduma yote, ni kupimwa tu na ile mashine basi. Lakini kwa kuchoma hawaja ni walisema watanichoma hawaja nichoma. Kwa sababu wale wamewakosa nyana ndio walisema hawana vifaa. Ndio wakanileta huko.
Conflicting reports from our sources in private hospitals, however, indicate that talks are still ongoing to schedule the said patients for treatment in private hospitals, and that no patient has been transferred yet. Which means that hundreds of those suffering from the disease may have had to put their treatment on hold. The Kenyatta National Hospital has also announced that it is in the process of commissioning and calibrating a new radiotherapy machine, which should be up and running within a month, in hopes that the modern machine, which costs about 300 million Kenya shillings, will ease the cancer burden in the country.
The engineer tells me that within 1 month we should be able to have our patient here, but we are working around the clock to see whether we can reduce even that time, so that even as the other machine is going to be working, we will be able also to treat the other patients from here.
Over the last few years, Kenya has seen a rise in the number of new cancer cases without a corresponding increase in the capacity and improvement in cancer treatment infrastructure. In fact, this is the second time just this year that radiotherapy services have been suspended at the Kenyatta National Hospital.
We need to increase the number of machines going forward, and this is a plan that is there, not just with us, but also with the government. So we want to believe that even where we are standing right now, our dream is that in 5 years' time we should be having probably 4 machines of this kind within this place, because this is where we plan to have the Cancer Center of Excellence.
Alarming statistics from cancer awareness organizations estimate that about 40,000 new cancer cases are diagnosed every year, with 27,000 deaths possibly due to inadequate treatment. This is a worrying trend, especially keeping in mind that the only public national cancer treatment facility in the country has a long waiting list, with appointments stretching all the way to next year. Fatma Pole, KTN News.